Hello and welcome to another edition of Health Matters. On this episode, we are going to be talking about something that is very, very crucial to all of us because it's going to affect all of us at some point or another. And that's going to be arthritis. But not only are we talking about arthritis, we're talking about a breakthrough in arthritis. When I say breakthrough, sound the alarms. This is a good one. So anybody who follows me knows I'm very much into regeneration medicine and new advances. And what I'm going to go over today is something that is new but not new, and it really has the potential to change patients' lives in a way that we haven't seen before for a condition that we normally relatively cannot control. What is it? What are you talking about? All right. I'm talking about A2M for arthritis treatment. I will explain exactly what A2M is, I promise you. So, as we all know, arthritis is one of the most common joint conditions faced by millions of Americans worldwide, affecting the quality of your life, limiting your day to day function. Current advances in medical research have helped make us understand the molecular mechanism behind arthritis, including how certain proteins, such as Alpha-2-Macroglobulin, better known as A2M, how this plays a key role in its relationship with arthritis and how it affects the body. And we're really going to get into how it affects the body, the different conditions associated with it, treatment options, and managing arthritis through. So, what is A2M? So, A2M is alpha-2-macroglobulin. It's a large plasma protein that is found in the blood. It is in us already, which is why I love it, right? It's already in us. It's primarily produced by the liver, and it functions as a protease inhibitor, meaning it works to block the destructive enzyme that we call protease. Protease is what breaks down cartilage and other joint tissue. So also, the other things that it does that are affected by they're associated with inflammatory conditions. Some of the matrix has properties that inflame the areas, and A2M helps bring it down. So let's get into some of the key functions of what A2M is. So primarily, it's a protease inhibitor. It inhibits the enzyme that degrades cartilage and connective tissue. It has anti-inflammatory properties. It can reduce inflammation that's caused by typically arthritis. It's joint protection. So by binding with destructive enzymes, A2M protects the joint and minimizes tissue damage. So here's what I want you to think about, and it'll come to you by the time I'm done with this presentation. A2M, I want you to think of it as a force field. So if you grew up in the 70s and 80s, you'll know any kind of one of those superheroes, they hit the button and they put a force field around you. That's what this is. So A2M, I want you to think of it as a force field around. So that's what it's going to do. So the other thing that you're going to hear me do is I'm going to repeat certain things multiple times. And I do know I am repeating certain verbiage multiple times. By the time you're done listening to this podcast, you will understand what A2M is and how it affects the joint. And that's the point purpose of me doing this a few different times. So understanding arthritis and its connection to A2M is important. So arthritis itself encompasses over 100 different conditions characterized by inflammation of the joint. The most common types are osteoarthritis, better known as OA, and rheumatoid arthritis, better known as RA. The role of A2M in joint protection in healthy individuals is when A2M, so right now A2M is circulating abundantly in us, in our bloodstream, and it manages enzyme activity properly, preventing joint deterioration. However, there's a big however, in individuals with arthritis, excessive proteinase activity overwhelms the A2M and it affects its ability to protect the cartilage. This imbalance is what leads to tissue damage, chronic pain, and loss of mobility. So basically, what that said is we do not have enough in our body to protect ourselves from the damaging effects of the protease enzymes. And when we put more in there, watch what's going to happen. Interesting. Okay. So arthritis, does it affect a lot of people? Arthritis around the globe will affect millions of lives. How many? In the United States alone, 58 million adults have arthritis, according to the CDC. Worldwide, 350 million people living with some form of arthritis. Osteoarthritis alone affects more than 10 to 15% of the global population. Those are staggering numbers. If we could do anything to slightly help people with arthritis and give them another form of hope that they don't have to have swollen red hot joints, inflamed joints, can't go up and down the stairs, can't play with your kids, can't play with your grandkids, can't run, can't walk, can't live life. The golden years aren't very golden because you can't walk. Let's take it back. So speaking of taking it back, I'm going to take you back to the origins. So I'm going to give you when it started, how long it started, how long has it been here? Okay. So A2M therapy is exciting development in the arthritis treatment, but it's relatively new in the field of medicine. Scientists have studied A2M for several decades due to its role in regulating the destructive enzymes in the body. But its targeted application in the joint health and arthritis has just begun to gain traction over the last couple of years. When did it really start? So the discovery of A2M was first identified in the mid-20th century as a large plasma glycoprotein that serves as a protease inhibitor. Its ability to trap harmful enzymes made it an attractive candidate for therapeutic applications. Research evolutions was like this. Early research in the early 1990s, not long ago, 1990s and 2000 studied A2M's role in neutralizing destructive enzymes in various conditions, including joint degeneration. It wasn't until advancements in regenerative medicine like platelet-rich plasma, PRP, and biochemistries allowed scientists to isolate and concentrate A2M from our own body's plasma. So what are some of the practical applications? Clinical interest in A2M for arthritis started in the early 2010s with advancements in biologic and regenerative treatments around 2015 to 2016. Listen, folks, 10 years ago, very new. Orthobiologic clinics started to offer A2M injections as an alternative to some of the more harmful treatments. They've had great results, which is why I'm talking about it today. So how long has it been used for? Although it's been discovered back in 1990s, it really wasn't used effectively until the last 8 to 10 years is when it's really started to become. And to be quite honest with you, it's really starting to gain traction over the last 12 to 18 months is where it really started to gain traction. So documented results, A2M therapy is backed by smaller clinical studies and reports of patients' responses. Here's what the researchers and practitioners have observed. Reduced inflammation. A2M has shown success in decreasing joint inflammation Patients reported reduced swelling and pain in treated joints, often within weeks of the injection. Slowed cartilage degeneration. Imaging studies such as MRIs reveal that A2M injections can slow or alter cartilage damage, especially in early to mid-stage osteoarthritis. This has been what's reported by other practitioners in the documentation that's out there. Improved joint function. Patients experience better range of motion and mobility in damaged joints following this treatment. Long-term potential. A 2016 study conducted by Cytonics, Cytonics, a biological company specializing in A2M technology, suggested that A2M injections could prevent arthritis progression by neutralizing protein enzymes like the MMPs involved in cartilage breakdown. Combined therapies. When paired with other regenerative therapies like PRP or HCTP cells, A2M enhances their effectiveness by protecting the joint environment from degradation. It completely protects it. So there are larger scale trials that are definitely needed for widespread acceptance, but early findings are so promising. So let me give you a couple of, we'll say seven fun facts about A2M therapy. So A2M therapy, it's a natural engineered snap trap. What does that mean? Okay, so A2M functions like a mouse trap. It binds and traps the harmful protease enzymes at a molecular level, rendering them harmless to your joint. Again, I want you to think of the force field around you. That's what it's doing. It's derived from your own blood. So it's isolated directly from your own blood. And with advanced blood filtration process, it is able to be put back into you, the patient, and help stimulate your cells. A2M is a big molecule. Literally, it is one of the largest molecules in your bloodstream, which makes it uniquely qualified to catch and bind to these enzymes that cause joint damage. A2M is part of your natural defense system. So A2M is already part of your blood. It's already circulating in your blood plasma, and it's functioning as a defense molecule. Basically, it's the defensive line if you look at it at football. So sometimes I'll put stuff in here to try to make it really simplified. So, because I know sometimes when I'm going through stuff I go through is with these podcasts, I do a lot of medical, and I really try to keep everything in a tone that you, the audience, can understand, and hopefully by you understanding it, you're telling and helping others. Side note, sorry. Okay, so A2M has medical roots in regenerative science. So A2M is one of many therapies that are coming out, and the incredible rapid growth of orthobiologics. So orthobiologic basically is a dedicated field to using natural substances to heal injuries through regenerative type tissues. Double duty A2M does. While it's famous for treating arthritis, it's also being explored for treating other injuries like tendon damage and degenerative disc disease. So there are some crazy good studies out there that has some significant potential. Who else is using this? So when we talk about regenerative medicine, not specifically A2M, but regenerative medicine as a whole, what we've noticed is over the last 10 to 15 years, it's really taken on a new world. And who's doing it? Who always does it first? The athletes and celebrities, right? So if we're talking about athletes, Kobe Bryant started it, right? In the NBA, he went to Germany for his regenerative therapies. Tiger Woods, professional golfer, well known for experimenting with PRP therapies. Peyton Manning, former NFL quarterback, connected to regenerative therapies for his multiple conditions. Cristiano Ronaldo, global soccer superstar, known for innovative recovery methods utilizing regenerative type therapies. Celebrities, Kim Kardashian, she's well known for doing PRP therapies and regenerative skin therapies. Angelina Jolie reportedly explored regenerative procedures for wellness purposes. Madonna, wellness enthusiastic, willing to experiment with cutting-edge treatments. Demi Moore, known for her interest in health and anti-aging therapies. So it is out there. Usually the celebrities and athletes, they are on the cusps of getting this, whatever is the newest and best thing first, they're getting it. So now the general public, it's out there and it's available. Let me tell you a little bit about how it actually works. So how A2M works for arthritis. So Alpha-2-Macroglobulins is a naturally occurring glycoprotein, primarily found in the blood's plasma. So it has shown potential as a treatment for arthritis due to its ability to bind to enzymes responsible for cartilage degeneration. We're going to talk about the mechanism now of how that actually works. So A2M works by employing a snap trap mechanism. We talked about that before, right? The snap trap is the mousetrap. The mousetrap is the protective covering. So this is a mechanism to inhibit harmful enzymes called proteases, which play a role in cartilage degradation. Specifically, A2M surrounds the protease and physically blocks them from interacting with their substrate molecules, such as collagen. This inhibition prevents the breakdown of cartilage and other joint tissue. The protease captured by the A2M include inflammatory and destructive enzymes like matrix metalloproteinases, MMPs, which fuel osteoarthritis by breaking down cartilage. So that's exactly what I said when I said the force field around it. It's basically putting the force field around it so your body cannot take it and it cannot affect you. Because this molecule is so big, it's able to capture it and surround it. And it is an incredible thing to have happened that we have found it, that the scientists have figured this out, that this is something that we can actually do to stop or halt arthritis. Okay, so let's get into biology of how it works and why it works. And again, I know I have repeated certain phrases and terminology multiple times, and I am doing that so you, the viewer, will understand it. And I will bet dollars to donuts that by the end of this, if you watch this whole thing, you will be able to say exactly why A2M helps with joint arthritis. Watch. Okay, so A2M's biological function lies in its ability to regulate activity of protease enzymes by forming a molecular cage around the active protease via its tetrametric structure. So right there, that tells you the molecular cage is the force field. So now you understand A2M works by creating a force field, a molecular cage per se, around the cell, and it blocks it. It neutralizes the enzyme responsible for cartilage damage. It also inhibits the inflammatory mediators and cytokines that are typically found in arthritic joints. When injected into an arthritic joint, A2M can reverse some of the inflammatory and destructive process by targeting the source of cartilage degradation. In addition to inhibiting harmful enzymes, A2M may promote anabolic metabolism, thereby aiding in the healing of joint tissue. What's the duration and effectiveness of ATM? The duration of A2M's effectiveness varies significantly depending on individual factors, such as the severity of the arthritis and patient's response to treatment. Some studies and clinical examples suggest that relief provided by A2M can last from several months to a year. There are some out there that saying it could be a bit longer. However, A2M does not permanently cure arthritis. Repeated therapies may be necessary for sustained symptom relief. Why? Doc, why? I don't understand. I had this. Why? Okay. The reality is we as people continue to age, right? So what A2M is doing in a point of time, it is trying to clean that joint up, but that only lasts for X amount of time. Your body, you as us as people continue to age. And when we continue to age, our body keeps producing those enzymes that cause destruction. And because we're not making enough of it, we continue to age. And that's why you need repeat injections. Got it? Okay. All right. Let's talk about the anatomy of arthritis and the joint breakdown and A2M's role in that. So to understand A2M, we have to understand arthritis more effectively. So let's explore the anatomy. So the structure of a joint. Joints are connections between bones, allowing movement and flexibility. Key components include cartilage. Cartilage is the smooth, slippery tissue that cushions the ends of the bones and prevents them from grinding against each other, right? Synovial fluid. That is the liquid lubricant within the joint cavity that ensures seamless movement. Ligaments and tendons. Those are connective tissues that stabilize and facilitate movement. What is the impact on arthritis? So when you have arthritis, you typically have cartilage breakdown. So the proteinases enzyme begins to attack the cartilage, leading to thinning and eventual destruction of the cartilage. Inflammation. Osteoarthritis leads to joint destruction, which can trigger an inflammatory response. But in contrast, rheumatoid arthritis activates an autoimmune reaction, resulting in joint swelling and pain. So at the end of the day, they both cause joint inflammation. Bone damage. As cartilage deteriorates, bones may rub against each other, resulting in deformities and future deterioration, right? The more you rub against each other, the more your joint will basically break down. You could take any two pieces of bone and you start rubbing it together, you will break it down. You will chip it off and it will be painful. Now you might have little fragments, so it's important to keep that cartilage and lubricant around the joint. Okay, the impact of arthritis can have an effect on function. So you could have a loss of function. When you have reduced lubrication, you have damaged tissue and inflammation, that's going to cause an inability for joint mobility over time. What are some of the other associated conditions that are associated with A2M for arthritis? So obviously the most common one is osteoarthritis. We've talked about that, right? A2M therapy shows promise in halting the progression by blocking cartilage, degrading proteinases. Rheumatoid arthritis, through primary autoimmune-based excessive enzymes, the activity plays a secondary role with joint erosion in RA. A2M might slow its damage down. Post-traumatic arthritis. So following an injury, A2M prevents proteinases-induced cartilage breakdown in cases where joint damage lasts over time. So how does somebody diagnose arthritis? So typically arthritis is, you're going to diagnose it basically with a great clinical exam, evaluate the joints. So your physician will do obviously a detailed history. They're going to do a great exam at understanding what your problems are, what your concerns are, and they're going to evaluate each joint for what is going on with the joint, with the motion. Is there swelling? Is there redness? Is there pain? Once they establish that, then they're going to go to their imaging studies, and whether they use x-rays, MRIs, or ultrasound, or a combination of all three, you're going to be able to see the damage in the joint and the structure. Those are the primary methods of identifying arthritis. So question becomes, well, how does arthritis really affect your life, right? Everybody gets it. Everybody gets it on different levels, right? So I have some patients that come in with a little bit of arthritis, and I have some patients that come in with a lot of arthritis. And it really, really changes a patient's life, right? So when you're bone on bone and your arthritis is affecting your ability to do your basic daily functions, that is a significant problem in your life. If you're wanting to do basic things, walking, going up and down the stairs, going to the store, and you can't do it because you can't walk, because you can't bend your knee, or you can't get dressed by yourself because you can't raise your shoulder, that is when osteoarthritis has really affected your life, and it's time to reevaluate what you're doing and how you're doing it. So arthritis can be devastating. The physical and emotional toll includes chronic pain, right? Persistent discomfort impacts your ability to sleep and concentrate, reduced mobility, stiffness, joint pain, decreased joint motion, your ability to do your daily activities, emotional strain. Persistent pain leads to emotional frustration and financial issues. Maybe you can't work anymore related to this type of condition, and it can also then lead to anxiety and depression. So what are some of the treatment options for arthritis? So typically, I'm going to stick to really A2M. So typically A2M is done with therapy, physical therapy specifically, to help exercise and strengthen and improve joint mobility. The other thing I'm going to talk about is a dual benefit. So if you combine A2M and PRP, platelet-rich plasma, the therapies offer together a significant benefit for managing joint pain, inflammation, and promoting regeneration, particularly in conditions like osteoarthritis and soft tissue injuries. So the benefits of A2M are, obviously, you all can tell me now. So it's a protease inhibition, right? It acts as the snap trap, the mouse trap, the cage around those enzymes, and it prevents them from having future joint degeneration. It's going to give you the anti-inflammatory effect, right? You're going to decrease inflammation, specifically targeting those inflammatory pathways. Joint preservation. Studies indicate that A2M can slow down the progression of arthritis by preserving the existing cartilage. So basically what that's telling you is an ounce of prevention is a pound of cure, right? So if you don't have to get there, your joints will be better. The earlier you do things, the earlier you start, it's about preventing, right? So meaning, if you're driving down the road and you see the storm, you see the wind in the storm, but it is sunny where you are, you want to make sure that you're not going to go into that storm, right? You're going to turn around and go a different way. Well, that's exactly what this is going to do. We're going to try to turn that joint around and get the arthritis to stop before it gets there. There is the benefits of PRP. So PRP is regenerative healing using your own blood, concentrated platelets, and growth factors, which stimulate tissue repair and regeneration, reduces your pain and inflammation. PRP promotes the natural healing of damaged tissue while reducing the pain and inflammation. The enhanced recovery time, the growth factors in PRP expedite recovery from soft tissue injuries and improve joint function. So PRP and A2M, really the combo, are we'll call them supersize your therapy, supersize your treatment. That's exactly it. If you're about recovery and trying to halt your progression of aging and getting your joints functioning, A2M and PRP are the combo that can really change a patient's life. So there are studies suggesting that the combination of A2M and PRP enhances both treatments. This approach addresses both cartilage breakdown, A2M strength, and tissue repair, PRP strength, providing comprehensive solution for joint disorders. So real quickly, I will go over some of the pros and cons. Pros: natural mechanism of action. A2M works by leveraging the body's own regulatory proteins, offering non-surgical options, targeted treatment. Unlike general anti-inflammatory treatments, A2M specifically inhibits cartilage degrading enzymes in the joint that you put it in. Potential regenerative effects. By limiting enzymatic damage, A2M may enable healing of soft tissue injuries. Minimal side effects. As a biologic derived from your own blood, your own plasma, risks of adverse reactions are low compared to synthetic drugs. Cons: it's experimental in nature. While promising, A2M therapies are still relatively new and lacks long-term clinical studies. Variable effectiveness. Patients may experience different results based on factors like injections in the site and like how much arthritis do you have starting. Costs. A2M can be expensive since they involve laboratory processes and the concentrate of the protein. Temporary relief. The treatment may require periodic injections for sustained benefits. I'm going to put a caveat into that. And what I like to tell patients are, because things do cost money, right? So obviously it costs my staff time. You have to buy certain kits, you have to buy certain equipment. And when you have value in your health, you have value in everything else that you do. Hear me for this. We as people put value in the cars we drive, clothes we wear, the things that where we go. But most people put the least amount of energy and value into their health. Meanwhile, we only get one of these things, right? Our body's only one. Maybe the smarter thing to do, maybe, is invest in us, invest in your body, prevent the things from getting worse so you don't get the arthritis in your 60s and 70s and 50s, 60s and 70s, and you're able to function well. And by doing that, the quality of your life will improve. The golden years can become golden. Because I have too many patients right now that could not wait to retire. Now that they're retired, they can't do anything because they don't function. Don't let that be you. Okay. I got some other facts I want to give you. A question somebody might ask me is, can A2M reverse arthritis? So the simple answer to that is no. A2M therapy does not reverse arthritis in the sense of regenerating lost cartilage or completely curing the condition. However, it might halt or slow down the progression of it, especially the arthritis, from addressing its root causes. Right? So if you slow it down or halt it, it might not get to the next level, and that's what we're talking about. Okay. Next question: can A2M regenerate cartilage? Currently, medical evidence does not conclusively show that A2M can regenerate lost cartilage or fully reverse arthritis. While it may minimize damage and slow the disease progression, once significant cartilage loss has occurred, regrowth is not typically possible without advanced regenerative therapies, such as HCT-PC therapy. HCTP stands for human cellular tissue and cellular tissue-based products. Other therapies can help. What is A2M best suited for? So early to moderate stages of arthritis, prevention of arthritis, and mitigating symptoms like joint pain, swelling, and stiffness. Supporting overall joint health, especially when combined with PRP. You combine that, you combine A2M, PRP, and physical therapy. That's your trifecta that you want to help your joints. So what's the future of A2M therapy in arthritis management? Several studies are currently out there exploring how A2M therapies may revolutionize arthritis. Regenerative medicine with A2M could become the key part of regenerative therapies at rebuilding damaged cartilage and tissue. Future studies, again, this is only a few years old. There is a lot of research that has to come out. And I'm sure we're going to keep hearing about different things. So right now, you're hearing the most up-to-date information that is out there currently. There's going to be a lot more things coming. And the good part about A2M with the feature is it's personalized to you because it's you and it's going into your specific joint that is having the problem. It's not like you're taking a pill and it goes wherever. You're putting it where it needs to go. Let's bring it all together. The ultimate approach to understanding A2M and arthritis. Arthritis is a complex condition that involves an interplay of physical, biochemical, and lifestyle factors. A2M is emerging as a promising option for halting progression by inhibiting destructive enzymes within the joint. While traditional treatments like physical therapy, medication, and surgery remain the cornerstone option, A2M-based therapies represent a growing field with enormous potential to redefine joint health. Understanding the science behind A2M allows physicians to offer innovative solution that addresses arthritis conditions at their source and ensuring patients regain relief of pain and preserve the quality of their life. So in closing, I'm going to basically tell you this. It was exciting for me to learn about it. I actually did my first injection 3 days ago. And I did it with the combination of PRP, and I am excited to see my results. And not only that, I'm excited to see what's going to happen in the field of arthritis and A2M, because there really is nothing out there that has led to the slowing down or stopping of arthritis. You could do HCTPs, you could do PRP, and there's different mechanisms of it. But the ability to put the force field around, right? I want you to think of the force field. So you think A2M, I want you to think force field, right? We're going to put the force field around the bad cell, and it's going to hold it and then take it away. That's what it's going to do. You should be able to tell me that by now, because you've heard it like 5, 6 times. But that's what I'm excited about. I'm excited about the future of therapies and treatments for arthritis, because we're going into a whole new world that we have not been in before. And I'm excited for patients' health, because anybody who knows me, if you heard my podcast, you know I'm all about function. Function's kind of my thing. And I love when I can be on the beginning stages or understanding what's the newest thing out there to help heal, treat, anything I can do to help patients get better faster, right? Faster, stronger, quicker. I want to do it for them. So I'm always out there learning. My learning has never stopped, even though I'm out almost 30 years. My learning has never stopped. And the ability for us to grow as people and to understand what's out there, it's so amazing. But if you don't know about it, if I didn't have friends out there in the field to tell me about it, I would never know about it. But I'm constantly looking for it. So thank God I have friends out there that are in the field, and we are all trying to help each other stay on top of what's out there. How do we help the patients the best? What can we do? This is one of them. So I'm going to leave you with one of the things I always leave you with. The information you received here are my opinions, and my opinions alone. They are not meant to be medical advice, medical treatment, medical solutions for you. Your condition is your condition. That should be discussed between you and your physician. This is just my opinion. If you have anybody who has arthritis in your family, and guess what? Everybody knows a lot of people that have it. Please pass this along to them. They could take one little piece of what I have said and help them in any way. It has served my purpose on why I take the time to do this for you guys. If you have friends or family that you care about, even something you don't care about, send them the video anyway. No, please subscribe, share. The little things that you can do to help somebody else is what makes us as people in the society get better, right? Help your neighbor, help your friend, help your family member, give them some information. Knowledge is power. As I always say, we only got one of these, right? It's important Take care of yourself, because at the end of the day, your health matters. I'm Dr. Chillemi. Till next time, be well, be safe.